There are three things that I see in my office frequently that are things that either women don't pay a lot of attention to, or maybe they're in a little bit of a state of denial, or even things that maybe they think they're normal, but they're not quite normal. And these three things are very important to detect early because they could be life-preserving if the earlier we detect them. And the last one that we're going to talk about is not really about life-preserving, but it's a huge burden, and it's something that causes a significant amount of stress on some of my patients. The first one that I want to talk about is postmenopausal bleeding. What that means is anytime you have a woman who's entered menopause, what that means is more than 12 months without a period, and all of a sudden they have vaginal bleeding. Well, most of the time this is nothing serious. However, sometimes it is. You should never have vaginal bleeding after entering menopause. If you've gone more than 12 months and have some vaginal bleeding, it's most likely something that can be easily corrected. However, in a small percentage of these cases, it's a life-threatening emergency that you may not know about. Why? Because some gynecological cancers present with vaginal bleeding and spotting. And the only way to figure this out is by coming to see a gynecologist. If it's me or your local gynecologist, it does not matter, but it needs to be looked at. It's never normal, but it's very common. The second thing is breast masses. Many times here in my office, I see a patient that comes in and goes, yeah, I was taking a shower and I noticed a little lump in my breast a few months ago. That's not okay either. If you notice anything in your breast, it needs to be followed up immediately. The vast majority of times, this is not anything serious. However, if you're over the age of 40, or if you have first-degree relatives like a mother or a sister or even a daughter that has had breast cancer or other forms of cancer, it's imperative that we get this looked at. Most of the time, an imaging study or something like that is all we need, but sometimes we may need to do biopsies. After all, the difference between living a completely normal, healthy life and sometimes dying from these diseases is how early we pick them up. And lastly is incontinence. Nobody's ever died from wetting their clothes. Incontinence is when urine leaks out when it's not supposed to. This is something that causes a huge amount of stress in some of my patients. They're worried about going out. They're worried about going to the movies and laughing or sneezing or going to their grandkids' ballet recital or anything like that. And this is a very big deal because the vast majority of incontinence is something that can be diagnosed and repaired in the office with simple urine analyses and sometimes antibiotics. Two types of incontinence exist in a very broad way. What's called urge incontinence, which is when the muscle of the bladder contracts when it's not supposed to, and that one is usually controlled with medication. And the other one is anatomical defects, which cause stress urinary incontinence. This one, the vast majority of times, is repaired through a surgical intervention. It's a surgery that takes anywhere between 10 and 30 minutes to do, and it's really not that big of a deal. But more than 80% of the time, we can repair incontinence with either very small, minimally invasive procedures or even just an office visit. So it's one of those things that you should not be living with if you have it. Call and make an appointment if it's not with me, with your gynecologist, and get this looked at. I've been a physician since 2001, and my area of specialty is obstetrics and gynecology. And what that means is that it covers the full gamut from the early teen years of women all the way through postmenopausal stages, including pregnancy.